Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the country records over 12,000 new COVID-19 cases for 2 consecutive days. Now active cases are nearing the 90,000 mark. Also, the health department detects 177 new Delta COVID-19 cases, increasing the tally to 627. And as cases continue to rise, more hospitals in and out of Metro Manila are being stretched to the limit. We speak to hospital officials from the Lung Center of the Philippines, Ospital ng Lungsod ng San Jose del Monte, Bulacan, and Cagayan Valley Medical Center live. The Delta coronavirus variant further spreads in the country as the health department detects 177 new cases. This brings the country's total count of Delta infections to 627. Meanwhile, there are also 12,439 new COVID-19 infections Thursday. This also brings the total COVID-19 count to over 1.7 million. The rise in cases mean more hospitals are getting full. Let's go straight to the source of the story. First up, we have Lung Center of the Philippines spokesperson, Dr. Norberto Francisco. Dr. Francisco, welcome to the source and thank you so much for your time.
Thank you, Pinky. Good morning to all our watchers and listeners. Good morning to everyone.
Let's start with the situation at the Lung Center. Kamusta na po ang ospital ngayon?
Napupuno na po, Pinky. Yesterday, our emergency room reached full capacity at 6 p.m. but kahit papano naipasok namin sa hospital. But the occupancy rate has gone up despite we have been adding additional beds for COVID cases. The operational bed capacity of Lung Center as of today is 207. You know, it varies on a day-to-day basis, give and take a few beds. For today, it's 207 beds. And out of that, we have 76% of that dedicated to COVID cases. That turns out and translates to 158 beds. Out of the 158 beds dedicated for COVID, 135 are occupied today. That is 85%. If we break that down, ICU or critical care beds is 88% occupied. Isolation beds are 100% occupied, and our ward cohorting is 79% occupied. So everything is above 75%, which is our critical level. And luckily, we are able to expand some wards and wings. Last week, we opened another non-COVID wing into a COVID wing, and over the weekend, we opened another COVID wing non-COVID wing to become a COVID wing.
So clearly, what's happening, Dr. Francisco, is kaya po kayo hindi pa ganun kapuno or nasa 75% and above kayo dahil nagbukas po kayo ng mga non-COVID at ginawa niyo pong COVID yon.
Yes. As of now, what is happening is with the fixed capacity of the hospital, we increase the dedicated beds, the percentage of dedicated beds to COVID. So yung mga non-COVID tsaka elective cases, kumukonti muna. No? Hindi namin matanggal lahat because it's the mandate of the hospital to treat all cases at any one time. So hindi talaga po pwedeng 100% COVID ang Lung Center. But we modify depending on the need. Pagka mababa ang surge, nasa 35% lang kasi ang dedicated to COVID. At the highest or the peak experience we had last year and in March, in the months of March and April this year, umakyat yan sa 75%. So now we are already 76% dedicated to COVID. And out of that, 85% ang occupied.
Mataas na yun Doc Francisco, kasi kung nung surge nung March and April, 75% na po. I mean, from March and April, just to understand it, yung binuksan niyo po na extra beds, nalampasan niyo na ngayon to accommodate COVID-19 patients.
Yes, But Pinky, noong March and April, with that dedicated bed capacity for COVID, our emergency room was 200% of capacity. Yun yung talagang nakapila sila. For me, the emergency room is a good indicator eh. Kasi pag napupuno yung emergency room, ibig sabihin, wala kang mapasukan sa loob ng hospital.
Wala na.
So like
Opo.
yesterday, napuno yung emergency room at 6 p.m. Kaninang umaga, nabawasan na yon. Meron kaming 4 na naipasok. So kahit papano, meron pa kaming nalalagyan sa loob. But also because, aside from adding wards dedicated to COVID, we also were able to construct the modular hospitals in our parking lots. So we have a fund name for these modular hospitals. We call them a hospitainer. If you look at them from outside, they look like container vans. But inside, they're fully equipped for moderate, severe, and critical cases.
Let me ask you those.
In certain proportions.
Opo.
Yes.
What do you call it? Hospital what?
Hospitainer, like a hospital and a container
na
van.
container.
Hospitainer.
Is this,
yes.
but are you referring to the one that the DPWH opened? Ito po yung tinatawag yung hospital na container?
Not yet. 3 batches na
Hindi
kasi
pa
yan, Pinky eh. Yes, we had 2 other earlier batches which are the ones operational right now. But the biggest is the one the one DPWH turned over to us just 2 days ago. But this is just the facility. This is just the facility. We need to fill it up with the necessary equipment. Understandably, COVID cases are very challenging to handle and to manage medically because you also have to minimize the exposure of the healthcare provider with the patient. That means we need to install CCTVs, telemetries, which are remote devices so that you can monitor the vital signs, the oxygens, and all other pertinent data from the patient from a remote area, the nurse's station, which is outside of the red zone area.
Opo, opo. Parang independent ho kasi siya eh. So kailangan nyo din ng infrastructure, parang ganun po to be able to monitor them.
Yes.
So because nagkaroon po ng ribbon cutting dyan, very recently yung hospital na kinonstruct ng DPWH, you're telling me right now that andyan na po siya pero hindi pa siya operational?
Not yet. Tsaka may mga fine-tuning pang ginagawa eh. But minamadali ito eh, kaya talaga na turnover. It was built in a record 40 days for 88 beds of moderate cases of COVID and anywhere from 18 to 20 additional ICU cases.
Okay.
These are comprised of modular, five units of container vans, and 4 out of the 5 is designed for moderate cases, and 1 unit is designed for critical case.
So, Doctor, ang tanong ho kasi ng tao doon sa mga suspected COVID cases, pwede pa ho bang dalhin dyan sa lung center?
Well, we do not refuse if they are there already, but we discourage uncoordinated transfers because we classify them according to disease severity. Hindi ko mo may 10 kama, halimbawa is lahat ng kaso pwede mong ilagay dyan. Because there are beds classified for critical cases and there are beds classified as non-critical cases. Why is this so? A critical case bed needs more equipment and monitoring. We must remember, pag COVID, bawal ang bantay, ano? So kung critical yung case, it's just like taking care of someone in the ICU na talagang 24/7 may nakabantay na medical staff. But this is on a remote control basis. So you need CCTVs, telemetries, and all those remote devices, plus a very adequate source of oxygen because most likely they will need very high amounts of oxygen. Normally, when someone needs an oxygen, on ordinary medical case, nasa mga 1 to 5 liters per minute lang yan eh. Pero pagka severe and critical COVID, they will require 10 times more oxygen. Yung tinatawag na high flow nasal cannula for COVID cases. Yes, this deliver 50 to 60 liters per minute. So clearly 10 times more. So kung yung mga lumang oxygen pipes na maliliit, hindi kayang isupply yung mga bagong machines ngayon.
So right now, your ER sabi niyo po napuno kahapon, 6 p.m. Pero fortunately, meron po kayong napasok. Kamusta po ang ER ngayon?
Yes. Right now, we have, it's 58% occupied, but 4 of those will be able to get rooms because these patients are already on high flow nasal oxygen. And then 1 will be transferred to the tent in the Philippine National Red Cross. Ibig sabihin, nasa mild lang siguro yan. Ano?
Opo.
And the other one is for admission, and the other one is less likely COVID, baka pauwiin.
I see. So just to recap that, no, Dr. Francisco, right now, you can still accept patients, but you are encouraging them to first coordinate with who? The one hospital command?
No, they can call Lung Center with a trunk line. The trunk line is available online, but I can give the number now. It's 8924-6101, and just ask to be connected to the senior house officer. But it has to be a doctor to call because we will be asking technical and medical information. Because we have to categorize the patient. Kasi kung halimbawa severe yung case pero ang available bed namin pang moderate, hindi uubra doon. We will not be able to provide the necessary level of medical care needed by that particular patient.
Got it.
So, kailangan,
kumbaga,
yes,
may assessment na ng doktor para alam niyo po kung may availability dun sa severity nung case nung pasyente.
Correct.
Okay, so,
So
all right.
Yes,
So
so that we can prepare the necessary medical equipment and also the necessary personnel. Kasi importante, Pinky, yung personnel eh. Pag ICU case, 1 nurse to 1 or 2 patients lang. Pagka-critical. Pagka yung mga moderate, 1 nurse hanggang 4 or 5 patients kaya nila.
Got it. All right. Dr. Norberto Francisco of the Lung Center, sir, thank you so much for your time and take care.
Thank you very much also, Pinky, and good luck to all of you. Take care.
And coming up, ambulances lining up and COVID-19 patients swamp the Ospital ng Lungsod ng San Jose del Monte in Bulacan. We'll get to know their situation after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Dr. Erbe Bugay of Ospital ng Lungsod ng San Jose del Monte, Chief. Doctor, also thank you for your time. Let me start. Yesterday po na-interview kayo at sinabi niyo po, puno na ho kayo. What is the situation now?
Currently, we have a 27 isolation/COVID ward, no? 27 bed capacity, and we have actually full yung patient namin, and 18 of those are confirmed COVID positive.
Opo. Yung pinapakita ho kasi natin ngayon, so meron ho kasi parang lobby na ho ba yan? At kahit sa labas ng ospital, naghihintay na po yung mga pasyente ho ba at pati yung kanilang mga kasama?
Yun yung lobby ng hospital namin, no? We converted it into a triage at hindi nakikita dyan yung actual emergency room namin. So this is the triage. And these patients are waiting for admission to our isolation facility.
Ilan pong naghihintay para maipasok po sa isolation facility?
Right now, we have 11 patients. We're just awaiting for the result of the RT-PCR of those patients inside the isolation ward. If it turns out to be negative, we can transfer it to the regular ward and this patient can be accommodated in the isolation ward.
Pero yung mga 11 na naghihintay, Doctor, in the event, let's say, nag-positive po yung 11, meron pa ho ba silang mapaglalagyan dyan sa ospital?
Actually, yung isang structure na nakikita nyo dyan, yung para, sa ibang hospital kasi it's tent, ano? So kami, ginawa na namin into somewhat a permanent waiting area. No? So na-admitan na namin ng pasyente yun. It composed of 4 rooms. So yung mga nag-iintay na yan, actually, kaya sila nandyan, admitted na sila actually. We're just waiting them na ma-accommodate dun sa isolation ward namin. These patients are admitted at the triage.
Opo, pending yung kanilang resulta ng RT-PCR.
Iniintay namin yung resulta ng RT-PCR ng mga pasyente sa loob ng isolation ward. Yung nakikita natin pasyente dyan sa lobby, sa triage namin, are waiting to be na ma-accommodate namin sa isolation ward. So right now, we have 27 patients sa isolation ward at iyan, around 11 patients waiting to be admitted.
Doctor, are you still accepting, meron pa ho bang mga dumadating na mga pasyente at kaya pa po bang tanggapin ng ospital yung mga pasyente who might be or are thinking that they might be COVID patients?
Meron pang dumarating, no? As much as possible talaga, we accommodate, no? Pero sa condition talaga ngayon, compared from last month, mas sobrang dami ng pasyente kumpara last month.
And when you say sobrang dami, give us a number. Ano yung
Before
tinalon
kasi,
ng pasyente?
last month kasi, we have, for the month of July, out of the mga na-swab namin, only 17 ng positive, no? Right now, ang data namin, 65 of our patients na admitted na na-swab, 44 patients turned out to be COVID positive. So in just a span of 2 weeks compared sa last month, talagang na-doble or na-triple yung kaso namin.
Kamusta po yung inyong mga... Doctor, go ahead, sir.
Yung supposedly, if it is confirmed positive, we're gonna transfer it into a COVID referral center or COVID hospital. So ngayon, ang hirap mag-transfer ito ng pasyente ngayon eh. Minsan ang waiting time umaabot ng mga 50 to 75 yung pasyente bago mailipat.
Wow. Kamusta po yung inyong mga supplies such as mga gamot at oxygen tanks, for example?
Yeah, the oxygen, yung mga supplies namin, we anticipate, actually last month pa, we already anticipate yung possible surge. So we have adequate supply. Kinausap na rin namin yung supplier ng oxygen. Kumpleto pa naman kami.
What about the profile? If you can just share with us the profile of the COVID-19 patients, are they, meron ho ba kayo nakitang shift from the last lockdown? Are they younger now? Are they unvaccinated? Ano po ang kanilang profile?
Ngayon actually, it's mixed ages, no? Mas younger yung mga pasyente before kadalasan, no? Usually mga senior citizen yung mga na-admit sa amin. So right now yung pasyente namin, 18 of patients are, only one of them are vaccinated by Janssen. And yung 11 patients waiting sa triage, dalawa lang din ang vaccinated.
So karamihan mga unvaccinated?
Yeah. Parang
what about
yung confirmed positive namin, 1 out of 18, isa lang ang nabakunahan.
Kamusta po yung inyong mga healthcare workers?
Yeah, okay naman. We were, ideally, talagang hindi naman yung ratio of healthcare workers to patients is kulang, no? But the DOH augment the hospital with 40 nurses, additional nurses to man the triage and the isolation ward. And we are requesting more for additional augmentation because with the surge, talaga nagdadagdag ng beds to accommodate the patients.
Okay, thank you, Dr. Erbe Bugay of Ospital ng Lungsod ng San Jose del Monte in Bulacan. Doctor, take care of yourself as well. Thank you. And still to come, these cars beside oxygen tanks line up as patients wait to be admitted at the Cagayan Valley.
Get to know their situation after the break.
You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Dr. Glenn Baggao, Cagayan Valley Medical Center Hospital Chief. Doctor, welcome to The Source also. Umpisahan ko na po yung aking pagtatanong. Earlier this week, nakita po natin yung video at mga litrato ng mga sasakyan na may mga pasyente sa loob, na may oxygen tank sa labas, gayon din kahit pati mga tricycle. How is the situation now? Ganyan pa rin ho ba today?
Yes, Pinky, unang-una, good morning. No? At good morning din sa lahat ng ating mga frontliners dito sa CBMC. Well, Pinky, actually ako mismo ang kumuha sa mga litrato na yon, no? At I tried to send it to several media practitioners para makita nila, ipakita din sa ating mga kababayan. Actually, that happened only during that day, no? Dahil yung iba, although meron po kami mga nilagay na mga tents doon sa ating waiting area at bago sila ma-accommodate dahil puno-puno po tayo ngayon sa COVID ward po natin, so we have to put them in tents. Pero yung iba po kasi dumating, ayaw po nilang mag-stay sa tents. So they prefer to stay in their vehicles na naka-aircon sila. So we just respected what they wanted to happen. So nilagyan na lang namin ng mga oxygen tanks dun sa tabi ng kanilang mga sasakyan. But after a few hours, pumayag din sila na malipat dun sa mga tents natin dahil nagdagdag po tayo ng mga tents. No? At we were given by the Office of the Civil Defense additional tents, additional air coolers, and additional beds.
Opo. Doktor, wala na pong mga kotse na nakalinya dyan sa labas na may pasyente sa loob?
Pinky, wala na po ngayon. No? Sabi ko kanina, it happened only during that day. Pero sa ngayon ay nasa mga tents na po yung mga waiting patients natin.
So tell us the situation now. Meron pa ho ba kayong mga kama? May ward pa ho ba? May espasyo ho ba sa mga ward at sa ICU?
Pinky, originally we allocated 150 isolation rooms for our COVID patients. No? That is in accordance with the directive of the DOH noon na lahat ng hospitals, private or public, will allocate 30% of their bed capacity. Ngayon, just about 3 weeks ago, ay bumaba po kami sa 80 ang ating total patients. Pero in just about more than almost 3 weeks, ay lumobo po bigla, no? Ang aming census. At sa ngayon, no, we again attained the record high of 228 patients. 228 ang pasyente namin ngayon, and out of the 228, ang confirmed po dyan ay 203. No? 203. And then we have 27 suspect patients. Ngayon, aside from these patients na naka-admit na, meron pa po kaming 20 who are waiting for rooms na nandun po sa ating waiting area. Yung mga tents po, nandun po sila.
Yeah, but how can you have beds, Dr. Baggao, when you said that ang inalat po ninyong kama, if I'm not mistaken, is 150 isolation beds. And sabi nyo, nag-positive na 203 more or less at meron pang 28 na waiting for the result. Tapos meron pang plus 20 na naghihintay sa tent. Wala na ho kayong kama.
That's correct, Pinky. Alam mo, nung maramdaman namin na tumataas na yung aming bilang, ay agad-agad kaming emergency meeting and we added another 50 beds, no? 50 rooms pala, 50 rooms. So ngayon, at lumagpas na naman kami sa 200, ang ginawa po namin ay nag-identify na po kami ng mga tinatawag naming step-down facility. At ito ay yung mga hotels na hindi na po ginagamit. At kami po ay nag-rent, no, ng dalawang hotels na meron pong 50 rooms each. Wherein dito po namin dinadala yung aming mga recovering patients. No? Instead of staying here up to the 14th day of their quarantine, dililipat na lamang po namin sila doon sa step-down facility dahil pagaling naman na po sila. So they're about to be discharged. So we will move them doon sa ating step-down facility. And then i-reserve na lang po namin yung mga rooms na iiwan nila for moderate to severe and critical cases. So ganoon po ang aming strategy na ginawa ngayon.
I understand, Doctor. No, so you need to find other ways to be able to empty some of the beds for the moderate, critical, and severe. Ilan ho yung inyong pwedeng, yung tinatawagan na step down, ilan ho ang pwedeng ma-discharge sa ospital at mailagay sa mga hotel, sir? Kung saan babantayan pa rin sila. How many are those?
We identified 2 hotels, Pinky, with 50 rooms each, no? So we can transfer, we can move 100 patients na dun sa step-down facility natin. Kasi alam mo,
Opo.
we cannot afford anymore to add more rooms dito sa hospital because we are a referral hospital in Cagayan Valley. Kami po yung COVID hospital dito. So we cannot also compromise the services that we are giving to our non-COVID patients. Kaya instead of adding more isolation rooms dito sa hospital, naisip po namin yung step-down facility na lang. Anyway, kung recovering na po yung pasyente, siguro mga 4 or 5 days na lamang po sila dun sa step-down facility, then they can be discharged basta wala na po magiging complication.
Opo. Dr. Baggao, I wanted to find out from you, yung sa mga pasyenteng dadalhin sa mga step-down facility, are they willing? Because I can imagine maybe some of them, as much as they want to be discharged, dahil who wants to stay in a hospital na matagal, baka meron ho silang pangamba na anything can happen kapag inilipat po sila outside a hospital.
No, we will make sure, Pinky, na lahat ng protocols ay masusunod po. And then we also deployed nurses na doon para mag-monitor sa kanila. At mas risky kasi pag pauwiin po natin sila, then later on baka magkaroon po ng complication. It's better that we continue to monitor them until such time that they're discharged or they've fully recovered, and that's the time we will discharge them.
Very quick question. What about manpower? How do you need more people or sufficient naman po so far?
Well, alam mo, Pinky, kung susundin po natin yung actual manpower natin, talagang we really need to add more. So nag-hire po kami, and thank you po sa Department of Health Central Office for giving us more funds to be able to hire more nurses, medtechs, mga pharmacists po natin, mga radtech po natin, mga respiratory therapists, nursing attendants. So we see to it that we will be able to meet the patient nurse ratio para hindi ma-compromise yung ating services sa ating mga COVID patients.
Okay. Dr. Glenn Baggao of the Cagayan Valley Medical Center. Doctor, thank you, and please take care of yourself as well.
Thank you, Pinky, and good morning once again.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.